Well, hello, class. This is Professor Richard. I want to talk to you today about monitoring. Monitoring. To monitor something is to observe, to listen to, or check over a period of time. So in central processing, everything is being monitored, everything is being checked, okay? Everything is being reviewed, okay? So in central processing, the dress code, you're being monitored. So in central processing, you would have on the blue scrubs. If you're in the prep and pack area, you'd have on the bouffant, the guys, if they have hair on the face like I do, they'd have a beard cover because, again, we don't want hair particles falling into those trays that you're putting together in the assembly area that are going to be then sterilized. You don't want particles of hair in there. So everything is being monitored. Okay, you're being monitored, your clothes, the temperature is being monitored, the humidity, and those sort of things. Okay, even the quality of water. The water, again, we talked about water as a tool, and for cleaning, water needs a detergent. Okay, so water is a tool. Okay. So those things are being monitored. The mechanical cleaners. We did talk about manual cleaning. That's when an item is washed by hand. We talked about the 3 sinks in the decontam area. Remember, the decontam area, you're going to have on your PPE. You're going to be monitored. Make sure you have on the PPE, personal protective equipment. Okay. All right, the gown. Okay, the heavy glove. The shoe covers the eyewear. You're going to be protecting yourself from these instruments that were used in the operating room. Okay. So again, everything's monitored. The mechanical cleaners we talked about, those are the washers. Okay. Those are going to be monitored. We don't want machines not to be effective, so they're always being monitored and always being checked. And so the washers, again, the washers is the process that they use. It's called that impingement. Okay, so the washers use that impingement process. That's that spray force that gets into, those instruments and sprays them. Okay. The ultrasonic machine, we talked a little bit about that. That process that the ultrasonic machine uses a process called cavitation. Okay, that's that high rate of speed, and so as it vibrates, okay, there's a bubble that's created, but that bubble implodes again and gets into the small cracks of an instrument. Okay, so the cavitation works by a process called ultrasonic works by a process called cavitation. The washers, sterilizers work by a process called impingement. So they're always monitoring, the machines that they're using to make sure that they're effective. Okay, and they're doing what they should be doing. Another machine is that's the AER, or the automated endoscopy processor. We talked about the endoscope is that long tube that they can use down your throat or up the rectum for diagnostic purposes. So that machine that they use, which is a high-level disinfectant to to disinfect those instruments between patients, between surgery. Everything is being monitored. Okay, another way that things are being monitored, there's printouts. So on the washers, there's printouts. A printout basically exists if once you press the button on the machine, there's a printout or a paper that's documenting everything that happened, so you can check your records to make sure that the process did what it's supposed to do. Okay, so unlike the washing machines at home, there's no printout, no document that you have to save. Okay, or the stove, once you hit the stove, there's no printout or no paper record. But in central processing, everything is being monitored, everything is being checked, because record keeping is crucial. Okay, the records, again, they must be legible. If somebody comes in and say Jacob, we talked about Jacob, they come in and they inspect the hospital central processing. So they have to have, once they look at your records, they have to be able to understand them, they have to be able to read them, they have to be legible, and they have to be accurate, and they have to be complete. Okay, so everything's being monitored, everything is being tracked. We talk about the printout, so that's a written record, in the sterilizer. Okay, what time the cycle started. Okay, how long it took before it reached sterilization. We know that sterilization for steam 250 to 275. So they're talking about those sort of things. Those are accurate. We have to make sure that the machine did what it was supposed to do. Okay, so record keeping and documentation is important. Everything, those are those records. So we have a proof of everything that went on during that cycle. Okay. Now, there's another term they talk about called a Julian date. Julian date. That's the number of days that have elapsed since January 1st. So January 1st on the calendar is day 1. December 31st is day 365. So in central processing, they use that Julian date. So we talked about wrapping instruments. When we wrap, right, always the indicator goes inside, right? Then the tray is wrapped. We talked about on the trays, the outside, on the external indicator, which is that tape. That's the external indicator, because that shows you once it goes through the sterilization that it indeed has gone through the sterilization, because the color change of the tape. Okay, so the tape on the outside of the package is the external indicator. The chemical indicator is the indicator inside that changes colors. Okay, but the only time that somebody will be able to see the chemical indicator is once that tray is brought over to the operating room or to the clinics, and once it's open, then the sterile person, can reach inside and make sure that that has happened. Now, if that chemical change hasn't happened, that tray is considered contaminated and cannot be used. Okay, but getting back to the Julian date, again, we said that Julian date on the calendar, day 1 is January 1st, day 365 is December 31st. So on the packages that we wrap, we talked about on the outside, we put the date, okay, when it was wrapped. We put the name of the tray, and we put our initials. Okay, so those are things that you do. But once that tray leaves your station and goes to sterilization, before it goes into the sterilizer, they put like a stamp on it, and that stamp is like the control number. It's like an ID, and it tells you, what sterilizer it was in, what time it went in. So there's another tracking that goes on, but there's more than just your name, the name of the tray, and the date it went in. Okay, so there's a control number. Okay, so if there's something that happens, because everything's being documented, everything's being tracked. So if you have 3 sterilizers and they're going continually, you want to make sure you know which tray was in which sterilizer, if there's a problem, and at which time. So record keeping and monitoring is crucial. Okay, another term I want you to understand is validation. So when they talk about validation for an item, a validation is a company saying, okay, this is what the product can do. Okay, so the company's saying this is what the product can do. Okay, so the other term is verification. So the company validates it, says, yes, we said the product can do this, 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 this. What we have to do in central processing, what we do, we verify and we prove that what the company said is true. Okay, so validation, that's when the company says this is what the product can do. Okay, and we, as a consumer, we verify. Okay, and if we can't verify that validation, then we would get another product. Okay, so validation comes from the company saying this is what the product will do, and we verify it on the job. Another thing I want to talk about quickly is the Bowie-Dick test. Okay, the Bowie-Dick, that's a test that challenges the door gasket and the door. Okay, so in order for sterilization or steam sterilization to occur, once the door is closed and the steam comes in, the air has to go out of that machine. Again, steam and air cannot be in the same place at the same time. So the Bowie-Dick is a test that challenges the door and the gasket and makes sure that, in fact, that all the air was removed out of the machine, so that the sterilization process, the steam coming in, again, the steam is a sterilant, and the high temperature sterilization has happened. Okay, so the Bowie-Dick test, okay? Validation, verification, the control number, like that stamp that's put on the packaging so that you know what cycle was run. All right, so I'll see you next time. Thank you.